Thank you to each of you for joining us today. And to those of you watching on Facebook Live on the TMDSAS page, the Texas Health Education Service page, and on the Texas Jam page. My name is Enrique Hasso. I'm the Associate Director of the Texas Health Education Service, located in the TMDSAS office here in Austin, Texas. And we've got a fantastic panel joining us today as part of our second night of the partnership that we have with the Tour for Diversity in Medicine group. So thank you very much to each of you for joining us today. We're going to get some great information out about everybody's experience for being a physician or doctor here in Texas. So if you have any questions that do come up for this panel, I'll be kind of hanging out in the background and forwarding you questions to this panel. But for now, I'll leave it to Dr. Landry, who will be moderating this evening.
Thank you, Enrique, for hosting us and bringing us on. We are excited about this partnership and a chance to talk all things Texas. We have an amazing panel of individuals who are going to be joining us for the next hour, hopefully to answer as many questions as possible. The Tour for Diversity is excited about this partnership. We actually did one of our tours in the state of Texas. It was our third tour. We went all the way across the great state of Texas, starting in El Paso, working our way to San Antonio, going down to the Valley, and then finishing up right around the Houston area. We have a lot of members of our organization who have ties to Texas, either because of their clinical training or their medical school training, or they're from Texas. I think, we love to represent Texas. As you can see, I'm wearing my PVAMU gear because I'm a proud graduate of Prairie View A&M University and a son of Texas. But I think what I want to do first is just go around and have our amazing panelists introduce themselves. And then the first question I'll ask you is tell us about your Texas ties. And I'll go with you first, Dr. Romero. Tell us who you are, what you do, and what are your Texas ties?
Hey, it's great to see everyone. I'm Dr. Minerva Romero Arenas. I'm a general and endocrine surgeon. I actually am from Mexico City originally, but I grew up in Houston, in Southwest Houston, and I went to the schools in the A-Leaf, Texas school system, so from the SWAT. I grew up in Houston. I lived in a few places in the Southwest, and I did some of my training in Baltimore. I did a fellowship in endocrine surgery at MD Anderson Cancer Center, which is part of, which is actually the #1 cancer center in the world. And I worked down in Rio Grande Valley at the University of Texas for a few years. I've recently just moved, actually, and I'm now establishing my practice in New York City.
All right, I love it. Got that SWAT representing Southwest A-Leaf. Go ahead. All right, thank you, Dr. Romero. Next, I want to go to you, Dr. Cruz. Tell us about yourself. Tell us your story. What do you do, and what are your Texas ties?
So, good evening. My name is Jose Cruz. I am from South Texas. I am from the Rio Grande Valley. I went to school up in the Northeast. I did my medical school in University of North Texas, TCOM. I further went to residency in Oklahoma, did med peds, and then did a subspecialty training that I'm completing now in Louisiana. And I'm scheduled to go back and be a full-time hematologist and oncologist in the Rio Grande Valley, back in my hometown, starting sometime in the summer.
Hey, congratulations, my man.
Thank you.
All right, Dr. Henry, tell us your name, what you do, a little bit about yourself, and your ties to Texas.
All right. Hey, what's going on, y'all? My name is Brandon Henry. I am a sports medicine doc, currently out in Riverside, California. I am from LA, but I did my medical school at the Mecca Howard University in Washington, D.C., and then came back to Cali, did PEDS residency there, and then my ties to Texas would be where I did fellowship. I did my fellowship at Baylor University in Waco, Texas, where I was on medical staff for their athletics. Sikkim Bears. And then I felt like I would go ahead and wear this for y'all. This is my, if I can get it off, this is my Big 12 championship ring for when our women's soccer team won the Big 12. There's my name there in the Baylor Bears. So I feel like I go ahead and just do that while we're here. So.
All right, thank you for representing. And as I mentioned, my name is Dr. Alden Landry. I'm an emergency medicine physician. I'm originally from Texas. I was born in Baytown, Texas. I was an Army brat, so we moved all around the country, but home has always been Texas. You know, all my family is right there in Northeast Houston or in Liberty County, just outside of Houston. And ended up going to undergrad at Prairie View A&M University, right outside of Houston. Best decision of my life, really shaped me as the individual who I've grown up to become. Ended up leaving for medical school, and I've been up here in Boston at Harvard Medical School, serving as the Assistant Dean for Diversity, Inclusion, and Community Partnership for the past few years. I also helped to co-found and co-direct the Tour for Diversity in Medicine with Dr. Cameron Matthews, who was with us yesterday evening. But I'll say this, it's you know, it's an honor to be here. It's an honor to be talking to fellow Texans, and it's an honor to talk about Texas in medicine. But I think first things first, one of the things I want to unpack is something that's very germane to what's happening with us across our entire country, but it's particularly hitting our Texas hard, and that's COVID-19. And so I want to just have a brief discussion with you all about what are your experiences, not necessarily related to practicing in Texas, but how has COVID-19 impacted you as a physician? And so maybe I'll go to you first, Dr. Henry, because I remember you telling me stories about your experience in the COVID line with cars driving up and you having to do those swabs. So why don't you tell us about your experience as a doctor during this COVID era?
Yeah, so, you know, it's as a sports medicine doc, right, as soon as the pandemic hit and realistically, as soon as Rudy Gobert came down and he was the first athlete that came positive with the virus, sports really just kind of shut down from there. So I didn't really have much work to do as a physician. And so, you know, like Dr. Landry and then a bunch of our other docs that are on the tour are like in emergency medicine or in the ICU. And so I felt like I had a lot of close friends that were, when they say front line, that are really in front of this thing. And so I felt it was a call to duty for me to somehow get outside and be in front of people who were suffering. And so what I decided to do was I took it upon myself to really kind of be the only physician that was doing the COVID testing. And so we had our drive-through lines, and it was amazing being out there because it was just crazy how it kind of started. And you have a couple cars that were coming in to get tested. And then all of a sudden those couple cars became like 50, and then all of a sudden it became 100, then all of a sudden it became a couple hundred. And as you're seeing people in the line to get tested, the look of fear, in a sense of just being scared on their faces and just trying to talk to them. Or I had one guy that he was so sick that he was driving and we kept telling him to pull forward. And every single time he would stop, he would almost it was almost like he dang near passed out at every single time he was stopping. It was hard trying to keep him with it, right? To where we could even test him. So it was just crazy to see how sick people were. And then when you hear everybody kind of saying, oh, it's not real, it's not true, but you're seeing how sick people are right there in front of you. And you're trying to tell them it's okay, you know, hey, we'll get through this, you know, and just trying to comfort them. It was pretty scary at first. It was definitely scary. I mean, it still is, but it was just something we had never seen before.
Yeah, it's been a really tough time for a lot of us. Dr. Cruz, what have been your experience as a hemonc doc dealing with COVID-19?
So the hardest part of dealing with COVID-19 has been from a patient perspective. I see the repercussions from a patient perspective. COVID has impacted the way that we operate on the outpatient basis, meaning in the clinic. And so one of the things, the nature of hemonc of oncology is you're dealing with cancer. And so for the most part, those are not pleasant news that somebody wishes to hear. And a lot of our patients require emotional support. They require to have somebody there for support, for strength, as kind of a cheerleader. And so one of the ways that COVID has impacted the way that all clinics operate is that family members are no longer allowed to come into the patient's room unless they have to provide, are there for some sort of physical assistance. And so the hardest part for me has been having to break news to patients and there being nobody there to support them. You know, we tend to forget that, you know, nowadays, you know, COVID has really impacted not only the way that we operate, but also our ability. I think it has impacted our ability to sympathize with patients. Like before, let me just give you an example. Before, when a patient would cry, for the most part, you were one of the easiest ways to ease or to help the patient know that you sympathize with them is maybe a tap on the shoulder or a tap on the knee, and you can't do that anymore. And so just not being able to be there emotionally for the patient, it's pretty tough. And I feel that is one of the things that is hard to work through, especially since, you know, the kind of patient population that I deal with on a day-to-day basis requires that emotional support, and the fact that you're not being that you're not even able to take care of the most basic instinct is just like very I feel very disheartened as a physician that I'm not able to be there in that emotional way, and it's tough. It's just been heartbreaking for me not being able to be there for my patients in that way.
I have to agree with you 100%. You know, a human touch goes a long way, and it's one thing that has essentially been eliminated from medicine. You know, whether it's the handshake when you greet the patient when you walk into the room, or the touch on the shoulder when you break bad news. So it's been amazingly difficult as we try and continue to maintain that humanistic side of medicine, in addition to just the art and science of practicing. Minerva, Dr. Romero, I want to turn to you. What are your thoughts about this? How has COVID-19 impacted your practice as a surgeon?
Yeah, so, you know, I did not have, like you, Dr. Landry, I did not have the ability to stay home from work. There are many conditions in general surgery that were still considered essential and life-saving interventions. And so similarly to Dr. Henry, my elective practice really shut down. And there were several months when, you know, we essentially had recommendations to not do anything that was not truly considered life-saving. In that regard, I also felt like I should volunteer. And so, I volunteered for taking as many of the general surgery call days as was reasonable. I saw a lot of patients who were hesitant to come to the emergency room because, of course, they were getting warnings to avoid hospitals at all costs. And unfortunately, that also translated to many people coming in with more advanced disease. So maybe an appendicitis that you could have caught early was actually ruptured and caused a more severe infection than we would routinely see. And the same thing for other conditions like hernias, gallbladder surgery. And unfortunately, we also saw a similar impact in patients who had cancer, where some of the cancer care was unfortunately delayed. Some of the patients didn't feel comfortable having their surgery. And it was a little bit hard to really provide a lot of guidance in terms of when is it appropriate to proceed with an intervention? When is it appropriate to wait it out? You know, initially we thought it's okay to wait it out a few weeks because we weren't sure how long this, disease was going to happen. But when it became evident that we were really talking about years, months, maybe years, everybody, thankfully that our societies revised their stance, at least the initial stance, and we were able to proceed with other surgeries.
You know, and just to add on what you were saying, Dr. Romero, you know, when COVID, that first wave hit back in March, April, we had no clue what was going on. And it was a very dark place for physicians. And, you know, we're as a understanding of disease, obviously in a better position, but that doesn't make the disease any less deadly, nor does it make it any less scary for us to walk into the hospital. And I just want to say, you know, as a physician, talking to physicians, thank you for what you do. Thank you for continuing to care for patients. We obviously have a tough job. We chose this profession. And for many of us, it's been career affirmation, understanding that, you know, even despite how bad things are, we're still going to go into work and still going to do our job. So thank you all for sharing your stories. I want to switch it up a little bit now. You know, we got Texas ties. You know, when you think of Texas, what do you think about? So Minerva, what is your thoughts of Texas when you think of Texas? I'll tell you mine first. When I think of Texas, is barbecue. I'm all about the barbecue. I got my barbecue smoker in the back. You can't tell me nothing about my brisket. I know it goes hard. But when you think about Texas, Minerva, what do you, Dr. Romero, what do you think about? What's home for you?
So I'll tell you, one of the things that shocked me the most up here has been ordering tacos. Now, yeah. There's not much more Texan or American than Mexican food, right? And tacos definitely, the first time I ordered tacos here and they told me it was $6, my first question was, how many come in that?
Oh, that's funny.
You know what you can't get? You can't get breakfast tacos anywhere. And like, you know, every time I go back home, you know, if I'm not at Shipley's, I'm getting some breakfast tacos. And they don't know about the culture of breakfast tacos up here. So,
well, the good thing is I know how to cook, and so I have yet to go hungry, but it's definitely something that, you know, is needed when you're in a pinch for time.
Now, Dr. Henry, Brandon, you're an adopted son of Texas. You know,
yeah,
you got your Texas ties.
Right.
But what do you think of when you think of Texas?
So I'm gonna go ahead. So real quick, I'm gonna go two parts. One, with Dr. Romero was saying, so I still think Cali, we still got, you have to throw what's in there when we talk about Mexican food. So I just want to make it clear. I mean, again, I am an adopted son of Texas, and I love Texas personally. That time in Texas was by far one of the best times of my life. But anyways, first thing I think about when it comes to Texas outside of food is how crazy the high school football stadiums are in Texas. Every single time I talk to people, right, because of being in sports, and I tell people all the time, I say the three states that have by far probably the best athletes in the country would be Cali, Texas, and Florida. That's typically, those three states are unmatched for the most part. But when you look at stadiums in Texas, I mean, I just, like Allen, Texas, Allen High School, their stadium, $60 million for their stadium. And we're talking just one high school, just for them alone.
Ball is life, definitely in Texas.
Man, and it's crazy. I mean, in Waco ISD, their combined stadium for the two high schools was 13 million, and they've got press boxes, elevators that go up into the press box. Like, I always believed that when people talked about sports in Texas, and you know, again, being from LA, it's like, oh, okay, cool. Like, I know they're big, but I have got to say that sports in Texas, and it's not just about just football. It's just sports in general. And the way that towns take to sports, the way that things literally do shut down on Friday nights and for these games, for me was memories that I will never forget, and just seeing the way that those things go. So loved it.
I mean, just along those lines, Dr. Henry, going to Texas relays, you know, and going to UT Austin and watching the track races. I mean, you've got the pros running with high school students, and I mean, it's just a phenomenal experience.
So real quick, when you talk about the sports, right, because that Baylor has a prolific track and field team, especially when you talk about like the 400 meters, and we've got people that are Olympians. And so the meet that we had there, it was Baylor, it was Texas Tech, it was University of Texas. I think Arkansas was there. I mean, it was just phenomenal to see these athletes and to see how excited everybody got for it. Again, it was one of a kind.
Yeah. What about you, Dr. Cruz? You know, you're not too far away from Texas right now. You're going to be going back pretty soon. But what do you think about when you think of Texas?
You know, I echo what everyone said, especially about the food. It's tough. It's tough not to think about the food, but first and foremost, like it's family and diversity. I mean, I've been very blessed to have lived in various parts of Texas, but I'll have to say that there is no two places in Texas are really alike. If you compare the Rio Grande Valley, you know, to where I did med school in Fort Worth, they're not the same. And if you compare the Fort Worth communities and like kind of culture, it's not the same as Austin. So there's a lot of diversity even within Texas. And so like I just miss my hometown. And one of the things is that it's tough to explain to people my hometown because you know, the Rio Grande Valley in and of itself, it's almost like a place unique of its own. It has its own culture, but then all kind of communities in Texas have their own little like culture, and they're all kind of like unique, but they're all unified in this sense of like, we're Texans, you know, like, and so, but they're all different. And, you know, when it comes to me and I think of Texas, I think about my hometown, I think about my family, I think about the food, I think about the cheap food, you know, have to emphasize the cheap part, and just, you know, culture and diversity.
You know, and it's interesting, just along the culture and the individuality that happens in Texas. You know, I'm originally from East Texas. I spent some time out in El Paso, so I got that West Texas in my blood. Different time zone entirely, but it's a completely different environment out there. And then, you know, grew up or went to college on the other side of Houston, and just thinking about how different, even just being on opposite sides of the city of Houston can be as far as culture. You know, it's funny, we like to group East Texas all together. Where are you from? Oh, I'm from East Texas. Right. But there's so much diversity that happens even within East Texas. You know, we're joking, we're having a lighthearted conversation, but I want to actually tackle a tougher topic. So one of the flaws of Texas is that there isn't necessarily equal access in distribution of healthcare resources. We have Texas Medical Center, which is the largest medical center in the country. We have amazing medical schools, and new ones popping up all the time. We have school that you were once recently affiliated with, Dr. Romero, with UT Rio Grande. We have University of Houston popping up. But unfortunately, we have so many health disparities that exist within our state. So I'll go to you first, Dr. Romero, and then you, Dr. Cruz. Can you talk about how those health disparities, those health inequities impacted you in the care that you were able to provide for patients, or maybe how it limited your ability to provide care for patients?
Yeah, you know, that's a really important topic. And part of the reason that for me, going to the Rio Grande Valley was a really like a dream job was because it aligns with my mission to serve medically underserved communities, to serve diverse communities, to serve people who really don't have access to healthcare, sort of just to healthcare in general, but also to specialists. I was actually one of a few sort of first set of specialists that came down to that region. And so I really wanted to sort of be able to do that. And thankfully, that's something that I feel I'm still able to do here in New York and in my practice in Brooklyn, which is also a very diverse community. But in the Valley, you know, unfortunately, I saw a lot of patients who were uninsured. The Rio Grande Valley is one of the communities in Texas, one of the regions that is actually the most poor, has really limited resources. And when we say resources, it can be something as basic as having internet access at home. It's about 60% of the community that actually has internet access at home. And you can think about with COVID, right, how much of an impact that could have on schooling, for example, and having access to the ongoing virtual education, right, that all our kids had to switch to. There's also big disparities in terms of education and high school graduation rates, the number of people who are uninsured. What this translates to, you know, in practice is actually having a lot of patients whose care was really fragmented, whose operations were paid out of pocket, whose families really had to, I had patients sell their cars in order to be able to pay for a cancer operation. And so, unfortunately, it also translates into incomplete treatment. And so when you're talking about choosing the best available treatment, but knowing that that patient may not be able to complete the chemotherapy that is necessary, or they may not be able to complete the sessions of radiation therapy, it really does start to add up. There are a lot of programs that really were made to help all of these patients try to meet the financial need, and certainly a lot of charity programs. But it's really unfortunate that our that our system has not really afforded those patients an opportunity to even be able to establish access to primary care. So it was really heartbreaking, certainly something that really affected my clinical practice, but something that I always try to work with patients to be able to help them, stay on top of it and get them to the care that they needed.
Thank you for sharing that, Dr. Romero. Dr. Cruz, similar question. What are your thoughts about the disparities? And doesn't necessarily have to focus on healthcare, but just in general, the inequities that happen within the state of Texas and how that may impact the patients that come into your office.
So I can tell you that from a social standpoint in Texas, when I was a medical student, one of the things that I saw is that, regardless of where you were, you still have these small pockets of communities in which patients were not only uninsured, but were afraid to seek medical services because of very aggressive immigration policies. And one of the things that I did as a medical student was you try to mobilize not only medical students, but physicians and residents to take care of these populations. And I think that now with even much more so aggressive immigration stand by the current presidential administration, I think that has, I imagine that has impacted the health of our communities in a much worse way. One of the things that I can tell you is I was very shocked by the fact that many people out there, regardless, we tend to think about undocumented, and the first thing that comes to our mind is like Mexican, South American, but we tend to forget that there's a whole diversity when it comes to people being undocumented. And you see that in the larger communities that you go. Like when I was in Fort Worth, we had a very diverse undocumented community there, and it was very disheartening to see that many of these people had very easily managed comorbidities that got out of hand, like diabetes, like high blood pressure, that led to really bad outcomes just because they couldn't see a physician because they were afraid to seek out help.
Yeah.
And so that has always been one of the most disheartening things that I have seen, and it's really impacted the way that I view my job as a physician moving forward, because I feel that my job is to provide care for patients, but also give more in regards to volunteering, because providing care to patients and working is completely different than being altruistic and providing of your time to go to these private clinics, to go to these community-based resources that are available to patients who don't have the resources, who might be undocumented, who might just be uninsured. And to me, that's the reason why I decided to pursue medicine, for the opportunity to give back. But at the same time, it is from a socioeconomic standpoint, it puts you to really examine the fact that many of these very manageable comorbidities can have long-standing consequences, and it's something that we see on all of our patients.
And I want to say first, just thank you for the two of you for sharing your thoughts. One of the things that I just want to highlight is not all, but part of the reason that our fellow Texans are in the position that they are is because of some of the decisions that leaders have made within the state regarding the expansion of Medicaid and the adoption of some of the policies that came out of the Affordable Care Act. I'm not trying to get political here. I just want to say that there are ramifications for the decisions that leadership makes when it comes to health and wellness of the state of Texas. And so as you think about who are our leaders, think about the decisions they're making and how that may impact you, your family members, the people that you love, the people that are in your community. All right, let's pivot another question. So a lot of us have ties to Texas from either our college experiences or from our high school experiences. And, we're all here, the students that are joining us here are here because they want to become physicians. And so what were some of the things that you found most beneficial along the way, understanding that we are here dealing with the COVID pandemic, and maybe the opportunities that we had as pre-meds or high school students may not be currently available to students. But, as you think, Brandon, what was a influential experience that you had as a either high school student or pre-med to get you in a position to be the best applicant for medical school?
The one that I have to go to is becoming a member of the SNMA, Student National Medical Association. That to me was the absolute game changer. I joined the SNMA in 2004, and prior to then, I had no clue of really anything, right? I didn't even know that people who look like me even were in medicine. I never had a doctor, never had nothing like that. People in my family didn't do this. People in my family didn't go to college. So I didn't know any of this. And one day when my advisor was like, hey, we're going to this conference for the Student National Medical Association. Do you want to go? Sure. Okay. Right. It was in New Orleans, and it was, that's where my family's from. So I was like, yeah, I'm all in. And when I tell you the first day that I got there and saw Black and brown people who looked like me, who talked like me, who came from backgrounds like me, who understood me in a sense, and seeing that these were the smartest of the smart people, and people dressed up from head to toe, and there's doctors, there's medical students, there's people who are in my same position, that it was life-changing for me. And literally maybe the first 2 days of my first conference, I just sat in the lobby of the hotel, and I didn't really say anything. I just watched. I just took it all in because I was literally amazed at what I was seeing, because, coming from LA, I'm not used to seeing Black and brown together in that kind of an atmosphere, and it's cool. You know what I'm saying? I'm used to seeing it on a whole nother different perspective. And so for me, it was like, wow, like I didn't know that we could all be in this thousands, right? I'm talking like 2,000 people be under one roof, and it ain't no problems. Like I was like stunned, but it made such a huge impression on me. And that to me, when I got back to school after that conference, it changed everything. I went and did a summer program the following summer, and then all of a sudden everything just rolled. And the networks that I got from the SNMA, the mentors that I got from the SNMA, I mean, it's crazy. And seeing Dr. Landry and Dr. Matthews when I was a pre-med, and seeing them in leadership, and remembering them when I was at that New Orleans conference, and remembering them from the St. Louis conference, and from, Atlanta conference in 2006, like it was just incredible. So SNMA was by far the biggest thing for me.
I think what you're trying to do right there, Brandon, is make me look old, but I'm gonna move on past that. On. I mean, it is what it is, right?
Yeah. Or it makes me look like I didn't know what I was doing, and I was struggling, because we the same age, but years ahead of me. So you can take it how you want to.
But I'm glad you found the light. SNMA, amazing organization. the Latino Medical Student Organization, also an amazing organization. I know, Dr. Romero, you have lots of ties to that organization. You can maybe plug the LMSA National Conference. I'm not sure what they're doing this year, but SNMA National Conference is always Easter weekend. I believe they're planning on hosting it either virtually or in person. If it is in person, it'll be in Orlando, Florida, this upcoming Easter weekend. If it's virtual, well, you'll be able to log on from wherever you are and be a part of that experience. But I do want to go to you, Dr. Romero. Meaningful, impactful, life-changing experience that you had either in high school or college that put you in the trajectory of where you are today?
So as a high school student, I wasn't entirely like tied to a career in medicine. So I would say just get good grades, know that you're college bound, and then actually follow through with all of the college prep things, right? And it's okay to not know at that stage. If I had it, in high school, I wanted to study dance when I got to college. So I think, don't feel pressure to be like, oh, I knew, at that time. I actually didn't know in high school that medicine was going to be where I would end up. Once I started exploring careers, I did, when I started thinking about healthcare, I did a program that a lot of us are actually have our alumni of this program. Back then, it was called MMEP. I think now it's gone through several name changes, and I actually, the last name I had was SMDEP.
It is now Summer Health Professions Education Program, SHPEP.
Okay, so in any case, that program actually kind of gave me a little bit of a roadmap, so to speak. I went to a school that didn't have an affiliated medical school, and so I thought that program was tremendous in helping me really think about the things that I needed to do to prepare in a way that that those resources are more readily available at an institution that has its own medical school. And then once I got to medical school, I also saw a lot of value in finding that community of students who understood the challenges that I faced, who were my peers, who had the same kind of goals in healthcare. And so I also joined an organization called Latino Medical Student Association. And it was really a tremendous source of support, which is something that is really necessary and essential to help you succeed and not feel isolated in school. And since I was given the opportunity, I am going to plug that LMSA is hosting a virtual conference for 2021. If you go to lmsa.net, you can find all of the information, but I know that they have a registration. If you register by mid-December for pre-meds, that's only $10 to attend the entire program.
That's awesome. Thank you. Another just shameless plug for SHPEP, Summer Health Professions Education Program. Actually, the applications are live. You can apply to participate in the program. It's open to college freshmen and sophomores. It is an amazing, life-changing experience. It is a phenomenal opportunity. It's a way for you to get exposure. There's 12 sites all across the country that you can go and participate, one of which is at the University of Texas Health Science Center in Houston. So if you want to stay close to home, you should definitely apply to that program. But there's opportunities all across the country. There's a couple in California, New York, Alabama, Louisville, Nebraska, Florida. Game-changing, life-altering experience. Many of us would not be in the position we are in if it wasn't for that amazing program. Dr. Cruz, similar question. What is that sort of game-changing moment experience that you had as a high school student or a pre-med that put you in a position to be successful?
I think that for me, it was finding a mentor and finding a person that would provide me with guidance. I, unlike the majority of my peers, I did not follow the traditional med school route, which is 4 years of undergrad followed by 4 years of medical school. I took a very non-traditional route, which was after graduation, I went back home, was a high school teacher for 4.5 years. I worked on my MPH, and in the meantime, kind of used that time to think about what I wanted to do with my life professionally. I wasn't from when I went through undergraduate. I felt that medical school, or that medical school was unattainable, just because of what I had heard, and not from what I had heard from knowledgeable people, but from what I had heard from my peers. And so everybody said, when you talk to your peers, it's what they say is one thing, and the reality of the situation is another. And so my peers were talking to them was very discouraging. I felt that I felt that I had messed up earlier in my undergraduate career, and I felt that medical school was unattainable. And when I had the opportunity to meet a mentor, to find a mentor, to say, hey, everything's possible. You just need to buckle up, and this is what you need to do, and got me along the right path. I felt that was very, very eye-opening to me, and much more so when I was in medical school, meeting other similar medical students who were in the same situation that I was, through like what Dr. Romero said, being involved in LMSA, having friends with SNMA, kind of having common goals, and meeting people who I know this will sound a little cliche, but who've had similar struggles. I felt that was like a very very good safety network, and very good safety net to have, even in medical school. So, I mean, to me, what made the most, what the most important experience as a pre-medical student would be to have found a really good mentor who provided me with awesome advice.
Yep. Thank you for that. I think, we could have a whole special session on just the importance of mentoring. And I thank you for sharing that, because none of us would be here if it wasn't for those mentors who have paved the way for us, who pulled us along, gotten us straight, pulled us by, pulled us by the ear, our shirt collar, to get us to act right, but then also been that voice of reason when we were ready to give up. So I think we're all in that space. Maybe I'll go to both Dr. Romero to talk about a mentor, and then Dr. Henry to talk about the opposite of a mentor, a gatekeeper. And who was that? So how did you overcome those naysayers? Because I know that Dr. Henry, you mentioned that you're first generation to go to medical school, first generation to be in this position that you're in now. It wasn't necessarily commonplace for people to be from where you're from to go into a career in the health professions. And so how did you overcome those gatekeepers along the way, whether it's a high school advisor, college advisor, to be successful?
Yeah, so, the tough part about, like you said, growing up was just the fact, like in high school, I was never told that I was smart, right? I was told that I was smart on the field, right? I was smart as an athlete, right? I was great at doing that. But I was never challenged in high school. I was never pushed to be academically good. I never even read a book in high school. But I didn't have to, because again, you have people who just told you you're an athlete. And that's what I thought. And that's what I went into college just thinking. And honestly, it kind of plagued me for the first, it took me 7 years to do undergrad. And I think for the first 4 years, I think that idea of being told in high school that you're just an athlete really kind of messed with me, because anytime I would mess up, it was easy, right? I could just say, well, I'm just an athlete. And I only came to college to play football. So, if I don't do well in this class, whatever. But being a part of a program that was at my undergrad called Science Educational Equity, it was a program that was really set up for students of color that were interested in going into professional fields, right? Whether it was medicine, dentistry, research, whatnot. And having advisors in there who would not let me believe that I was just an athlete, right? Having advisors in there who told me, you will. And if I did mess up, having advisors pull me into a room, close the door and say, Brandon, what are you doing? Because it's been 4 years and you have yet to take a science class. So what are we doing? You know, you're playing if you really want to do this. So to have those who loved me enough to challenge me, but yet give me the love that I needed and the encouragement that I needed, and then to be around students of color who again came from similar backgrounds and who were going to medical school and doing the things that I wanted to do. That was how I got over. But I also needed those failures, right? I needed to be put out of school twice for my grades in order for me to understand that I was slipping. It was the hurdles and the obstacles that did it as well. But you got to have good folks around you, because if not, you know, it's rough.
Dr. Romero, talk about how you have been aided in success with the help of strong mentorship.
Yeah, so let me just take a second to say to Dr. Henry, you are smart, you are special. We love you. You know, but I think it's really important because we don't hear that. And the truth is we don't. And I think, you know, sometimes it can be ignorant. Sometimes it can be people trying to keep you from getting hurt, or, you know, or keep you from experiencing failure. And so even though, you know, maybe they're well intended, it really doesn't help, right? You know, what I always tell people about mentorship is that you have to find good mentors regardless of where you're at. I have a tremendous mentor that I didn't meet until a lot later, right? In residency, I didn't have any women mentors. I pretty much still haven't really had like a Latina mentor. So I've had to look for mentorship in people who, you know, who don't look like me, who, you know, who are mostly men, and they've been great, right? And so I say that just because I think when people really are looking out for your best interests, they will do, you know, what you need them to do, and they will get you to where you need to be, and they will help you sort of plot that out. Now, in terms of, you know, who are some of the people that were influential and helped me, you know, I like to share a story, which is, you know, one of the people who opened doors for me, very often gives the advice, which is to grow where you're planted. And, you know, and I take that to really mean, you know, you have to find a way to thrive, right? You have to be that rose that grew from concrete. You have to really find a way out of all of the hardship and all of the struggles. And I really appreciate it because that as I left that institution where this mentor was, one of the gifts that I received was a door stopper. And it's a high heel shaped door stopper. You know, and the message to me with that was just, I really, you know, all that person did was help me get my foot in the door, and I did the rest of the work to kick the door open, right? And so the reminder for the door stopper is really to just remember that sometimes all I need to do in the future is to let someone in, but really the majority of the work comes from within ourselves.
Thank you for sharing that, Dr. Romero. And I guess the Texas spin on you know, the rose that grew from the concrete is even a cactus blooms flowers, right? And so we can be from the harshest environments and still bloom and still be beautiful. And I think that's just where it's at. You know, you have to remember that despite the space that you're in, whether you're in that high school where the majority of the kids are on free lunch, or you're considered to be in that inner city school that nobody is going to be successful from, you can be successful. And I think that you have to carry that with you along the way. Find the support and the mentors that you need. If the mentors aren't there at your high school or your college, find them elsewhere. One of the things that we pride ourselves on with the Tour for Diversity in Medicine is the fact that we mentor so many students along the way. And we're always talking about our W's, our successes. When we have a student who we met on the tour at an early stage in their career and helped to bring them along to help them to get into medical school. And we're seeing them go into residency now. And so reach out to folks like us at the Tour for Diversity in Medicine, because we're here to help y'all. So just remember that we're here. I want to go just quickly. Brandon, what's the one thing that shocked you about Texas? For me, it is the fact that it is so hot, right? And I'm from Texas, but just like the fact you'd walk outside and you just start sweating and you'd have to have a different shirt from where you were going. So Brandon, what's the one thing that shocked you about being in Texas?
Man, let me tell you, that hurt. You had to talk about that heat. And when I tell you in Central Texas and Waco, that, bruh, it hurt so bad. And I felt like I couldn't hide from the sun. I thought the sun was indoors with me. Like it was, and I felt like I kept running and it didn't matter what I did. The sun was right there. But the thing I think that was most surprising, because, you know, okay, being an adopted son of Texas, when you come from California, right, there's this thought of what Texas is and what people are like in Texas. And what I found to be what was surprising me is just how dope Texas is and how dope the people are in Texas, right? Like you really get this thought of everybody there is just kind of one way, right? Everybody's one-sided. And when I got there, I really recognized that people are just good people, right? I mean, it's like people were actually, again, very friendly. There's a big sense of community. There's a big sense of family. There's a big sense of, hey, whatever you need, hey, you know, and there's this idea of almost like a we at times, you know what I mean? And when you're there, and even if you're a transplant, when they notice that they know that you're a transplant, they still take you as, come on, right? Let's go. Let's get it going. And it's so it really, and it actually surprised me how much I enjoyed the rodeo and my cowboy boots too.
I love it. I love it. Dr. Cruz, similar question. Shocking. What was it? What was that? You know, what's so different about Texas compared to other places?
Just, I mean, I have to say, you know, aside from, you know, the fact that it's so huge and the food, the other great thing is, you know, the people. I think that the people make Texas what Texas is. You know, no, like Brandon said, you know, at the end of the day, you know, you're a Texan first and foremost. But I feel that, you know, just the people are unlike some of the people that I met in other parts of the country. They're welcoming. They're willing, even as from wherever you're from, they're willing to take you they're willing to take you as part of their family. And the fact that there's just so much diversity in Texas, that there's so many people that are willing to just take you in and make you part of their family is unlike anything that I've seen, you know, being in Oklahoma, being in Louisiana, being in the Northeast. I mean, people here are truly genuinely friendly. And that is something that I cannot say is true about other places. And the word here, the operative word being genuine. I think that people really are genuine here in Texas.
All right, Dr. Romero, different question for you. What is it, you know, you're now in New York. Is there something that you took from Texas that you said, you know what, while I'm here, I need this piece of Texas with me at all times?
You know, I'd like to say I took some of the Texas drawl. I definitely still include the y'all in all my emails. Y'all nodding because you know I put that in all my messaging. But you know, I really think the sort of Southern politeness that we often stereotypically say is absent in the Northeast, and that's something that I think really has made some of the things in this transition easier for me.
I'll tell you this, the one thing that from Texas that I've taken up to Boston, in addition to barbecue, is my Juneteenth celebration. So every Juneteenth, that weekend, where's the throwdown at the Landry household, where I make sure that everybody gets both a historical lesson as we talk about the significance of Juneteenth to the state of Texas, to the freed individuals, and then also how that is just such a big part of our culture in Texas. So Juneteenth, if you're in Boston, you're a Texan and you're looking for a nice hot plate of barbecue, hit me up and I'll make sure that you're well fed. All right.
Alden, I went to school in Texas and I didn't realize that other states didn't teach kids about it. And so I grew up knowing all about it and I didn't realize that it wasn't included in other history books.
Yeah, it's interesting. We skate around that topic, but as a Texan, I take that with me. So yeah, you're right. We know about this, but not everybody else does. All right, so we're nearing the end of our time, and I want to just again say thank you to my panelists for joining us. Thank you for hosting us. This has been a great experience and just being a part of this conversation and just an opportunity for us to talk. So maybe as we're wrapping up, as we're finishing up with maybe 3 or 4 minutes to spare, I want to we'll go in order of my screen, counterclockwise. Well, Dr. Henry, Dr. Cruz, and then Dr. Romero. Is there one sort of sage piece of advice that you got along the way that was really helpful? We talked about mentors. We talked about summer programs. We talked about how amazing Texas is. But, when you were in that dark time, was there something that was said to you that helped you carry on and move forward?
I was built for this. I was made for this. So the fight that it takes to get to where you got to get to, and when you're in those dark places and in those valleys, you were made for this, and you will get through this, just like all 4 of us on here have. It's in you, right? It's just a matter of just pulling it out, and sometimes that's the hardest thing, but it's there. You were built for this. So keep your head up, keep fighting, keep pushing, keep scratching, keep clawing, and keep digging. And don't accept no for an answer, and get what you got coming to you. Get what's yours.
Dr. Cruz, any sage piece of advice?
So I got to, first is like Brandon said, I was told never to give up. If this is, we'll face many obstacles along the way, along our professional careers, but if this is something that you truly want, just keep on working hard for it. And as long as your heart is in the right place, it'll eventually come to you. Try, work your hardest, know what you need to change. And if it's there for you, it's going to be there for you. So that's one thing. And then the other piece of advice would be, wherever you're at, try to find family. And by trying to find family, one of the things is try to find people who are like you, who think like you. Try to find that support system. That to me has been kind of the shoulder to lie on when I feel that I am in need of emotional support. I think that is one of the things that we take for granted, that we will face those hard times, and that we have to have our support system to be there to give us a pep talk, to tell us to keep to raise us, to kind of tell us to raise our heads up when we feel like crying, when we feel like giving up. We need that support system, and we need to find family, and family will sometimes not look like us, but family is what's inside their heart. And so find those people, find the people who will be there for you, and never give up on them, and never give up on yourself.
Dr. Romero.
So I shared a little bit of that advice, grow where you're planted. I would say along the same lines, yes, you can do it. And I think that's a really important piece of it. And then the last thing I'll say is measure twice, cut once.
Like it. I got a couple great pieces of advice along the way. And I try and share this. One of the things that actually came out of the tour, which I'll credit to Dr. Joseph Stringfellow, is you have a story. And it's a mantra that we've taken on as a part of the the Tour for Diversity. And it's your job to share your story, right? And so we all have amazing stories. Share your story. And then also, just similar to what everyone is saying, never settle. If you all want to be a physician, you want to be like Dr. Romero or Dr. Cruz, or you want to be a sports doc like Dr. Henry, never settle. That means you put forth the effort, the time, the commitment to get to where you're at. Delayed gratification is a huge piece of medicine, and we didn't even touch on that. But you're not going to reap the same benefits coming out of high school, college, and then going into a job like many of your friends will do. But if you are dedicated to a career in medicine, and you're going to be in a position like Dr. Henry, who took multiple gap years, Dr. Cruz, who took multiple gap years, but ultimately came out on the back end to be physicians and be successful. And now they're living their dream. They had to experience delayed gratification. And that's just a part of medicine, and it's where we are as a profession. I want to check in with our host and see where we're at with time. Enrique, thank you for allowing us the space to represent Texas so much, to represent Tour for Diversity in Medicine so much. It's just a pleasure to be here and have this conversation over the past hour.
Likewise, Dr. Landry, Dr. Romero Arenas, Dr. Cruz, and Dr. Henry, thank you all so much for these great insights. I've been writing notes feverishly in the background, just making sure that we cover all of this. And there are just so many great pieces of encouragement that you've offered all of our students. And I think that's really the key here, is that there are people out there who are willing to help. So we have shared links for you to get in touch with the mentors here and the mentors that we had yesterday and other mentors through Tour for Diversity. And we've shared several pieces of contact information for you to follow up, because at the end of the day, you get out of it what you put in. So on behalf of the Texas Health Education Service, TMDSAS, the Joint Admission Medical Program, and of course, Tour for Diversity in Medicine, our amazing, amazing guests, we'd like to wish each of you all the best of luck. Keep at it. It's going to be worth it. So thank you all so much, and we'll talk to you later.
EV.